Hello and good afternoon, everyone. Once again, we have met. This is Dr. Ali Atiq from Department of Pharmacology and Toxicology, Faculty of Pharmacy, Mahasa University, Malaysia. I'm head of Department of Pharmacology and Toxicology, and today I'm here again with an interesting topic, another interesting webinar, and I personally believe that you guys are waiting for this webinar because previous one was quite a success. So we have, before we start with the webinar, let me tell you about our faculty first. Faculty of Pharmacy offers a wide range of programs, starting all the way from from the diploma of pharmacy to all the way up to the postgraduate level PhD in pharmacy. So the diploma in pharmacy is a 3-year program, and after completion of that, you'll be able to call yourself a pharmacy technician. Then come our the most prestigious and for which what we are well known for is the Bachelors of Pharmacy. The completion of this program will be in 4 years, and once you are done, you will go to the clerkship. You will have an attachment in the hospital, and then you will be called as a pharmacist. We have a newer program as well, which I really want to introduce and want to use this platform to project our program. That is Bachelors in Pharmaceutical Technology. It's a new program, but as the name suggests, it introduces you to the market of the pharmaceutical technology and all the other industries which will require a knowledgeable person with the instrumentation, with the pharmaceutical development and pharmaceutical technology as well. Then I would like to introduce you about our postgraduate programs, that is Masters in Pharmacy and PhD in Pharmacy. And of course, these two programs are by research, and we have tailored these programs in such a way that on the completion of that, you can be a policymaker, you can be a researcher, or you can be part of any authority which will take care of the pharmacy and its profession. Now, without further ado, let me introduce Dr. Shahryar Afzal. You already know this person from the previous webinar. This is the second episode of or the continuation of the previous webinar that we have carried out a month ago. And the appreciation that we have got, we had no other chance to actually call Dr. Shahryar one more time. He is a senior lecturer of Department of Pharmacology and Toxicology, Faculty of Pharmacy, Mahasa University, Malaysia. So without any further ado, sir, the floor is all yours, sir. Thank you so much.
Hi, thank you very much. Thank you once again, Dr. Ali. Dr. Ali Atiq, once again, thank you very much for your very well introduction to me, and very warm welcome to all my audience listeners over here. And I'm very much grateful to you, all of you, with your all feedbacks and providing me the opportunity to give you another and one more round of my specialty, that is the Know Your Pets. Since I already mentioned to you that I'm basically a veterinarian, so this is basically my profession, and I just want to share my own expertise and my ideas with you regarding to know how to keep your pets at your home. So from the last webinar, so hopefully you have gained so much knowledge, and I was very much happy and pleased to have all the questions from your own side. And today I want to just add up some more information from the diseases point of the view, because this was the information which we lack in our previous in my previous presentation. So what are things we need to know if your pet is sick? So better take the notes. So what are the notes we need to take care? So probably I'm going to give you a brief introduction of few of the diseases which are basically concerned with the canines, with the canine category of the animals, which encompasses the cats and the dogs, probably because most of you having a habit of keeping these two animals as a pet at your home. So as a cat parent, it is important to recognize the basic signs, symptoms of the common illness so that you can seek the veterinary help for your feline friend. It's basically the feline, which in a timely manner if necessary. Feline is basically the cat category. The cat comes under the category of the feline family, And it is important that you should recognize these, what are the major signs, symptoms which will appear, so that they will help you in the diagnosis, or they will help you in understanding, and then they will urge you to keep your animal safe and take it to the veterinarian for the better take care of the animal, of the disease. So what are the common cat diseases? So we need to understand what are the common cat diseases: cancer, tumor, squamous cell carcinoma, lymphosoma, or lymphosarcoma, lymphoma, diabetes. So probably you will be very much astonished to know about that. Is this disease happen in animals? Yes, it is. It is very much important in case of the cats as well. But we will come to know that how much the percentage of this feline or the cat category, they suffer from this diabetic problem. Since we know there are the two types of the diabetes, type 1 and the type 2. And in the type 1, there's complete absolute stopping of the production of the insulin. Type 2, where is the impaired insulin production along with the inadequate response to the hormones. Then the heartworms, rabies, worms, which encompasses the roundworms, hookworms, tapeworms, and the lungworms. So these are the very, very major common diseases, common cat diseases. So which normally you probably will come across from all these kind of the your animal probably will come across with any of these diseases once in a life. And then once you come to know that these diseases have these signs, symptoms prevalent over there, then you are going to take care of your animal. Probably you will take the animal to the veterinarian, and then he will advise you that what kind of the measurements to be taken up to get rid of this type of the disease. So symptoms of, in case of the unwell cats, these are the generalized symptoms. These are the very well generalized symptoms for unwell cats. Means not feeling well, swelling on any portion or any region of the body, weight loss, means decrease in the body weight, diarrhea and the vomiting. It happens in case of the cats. Scaly and the red skin patches, loss of appetite, and change in the behavior. The animal, your cat, your pet probably become aggressive. Persistent sores or the skin infections, abdominal discharge from any part of the body, bad breath from the mouth. So probably it happens in case of the diabetes, one of the classical signs of the diabetes. Listlessness, lethargy, sudden lameness, means probably any of the limbs, either the forelimbs or the hind limbs, they got any injury in the leg or in the forelimbs of your cat. So what are major disease treatments? First, I will come to know about the major disease treatment, how you're going to take care of them, and then we'll go one by one. Common treatments include either you go for the surgery, chemotherapy, use of the chemicals, radiation immunotherapy, or as a combination of either of these therapies. Successful treatment depends upon the form and the extent of the disease and the aggressiveness of therapy. Of course, so early detection is the best way to do this one. So this is basically very much important, that how you're going to intervene and you diagnose the problem disease. So some disease can be cured. Some, almost all patients can receive at least some benefit from the treatment. And please note that if your cat is disease not curable, so you should not be worried, but you should have to still many things that you can take care of your pet feel better. So remember, good nutrition and loving care, it is very much important, can greatly enhance your cat quality of the life. So in that case, you need to prefer to contact your veterinarian. Probably in my case, if I'm a veterinarian, so you will come to me if your cat shows any of the clinical signs mentioned in the previous list of present over there. So these are the very much common signs. So based on those signs, symptoms, we will diagnose, or we will differentiate diagnose that which are the problems, what are the major diseases they are prevalent in your animal. Prevention, how you can prevent, just like we used to say, prevention is better than cure. So cure comes when the disease is there, when the normal physiology it disturbs. But prevention means that there is no disease, but we better take care. Remember, in my first webinar, I show you that what are the major diseases for which your animals should definitely get the vaccination. So keeping your cat indoors will protect them from the certain disease like the skin problems caused by sun exposure, sunburn. It is very much important because skin of the cat's feline category is very, very sensitive. So skin burn will take place. Breast cancer is a common cancer for the cats, but can be avoided by having your cat sprayed before her first heat cycle. In case of the animals, also we need to understand what are the reproductive cycle and what is the normal gestation period, and when your animal, the female, becomes at the heat. In that case, we need to understand that the cat should be sprayed so that there are no chances of getting the cancer in the mammary glands. What is cancer? It is a multifactorial disease. Probably we should know. I simply use the term PPP, which is the persistent purposeless proliferation. It is a persistent purposeless proliferation. The cells, they are going to be persistently, continuously, they proliferate without having any useful effect on the body. So it means it is one of no single cause is there. So we do know that both hereditary and environmental factors, they can lead to development of cancer in cats. So either the environmental factors or the hereditary factors, means passing of some of the genes from the parents to the offsprings, means from the male, either the parent, mother or the father of the animal. So they are suffering from this problem. So it is a common cancer for cats, but can be avoided by having your cats, just like I mentioned earlier over there. So what are the major signs, symptoms? What are major signs? Many of the major warning signs for cancer cats, they are similar to one seen in the dogs. So means when you see any of these signs appear in your pets, including the cats and dogs, so you should be alarmed. Unusual lumps or bumps on any part of the body, maybe on the forehead, maybe on the skin region, maybe on the abdomen part, maybe on the chest part, maybe on the limbs, swollen lymph glands, unexplained bleeding, especially from the mouth, and maybe from the genital orifices as well can. Difficulty in the chewing or abrupt change in the food preferences. So definitely you know as a pet what kind of the food your pet prefers. If there is any difficulty in chewing or any disallowing of the food by your pet, so you should be alarmed that having some problem. Foul breath from the mouth, chronic vomiting and the diarrhea. Chronic means it is going to persistent, passing for more than 2 to 3 weeks. Chronic weight loss. So you should have to keep in mind that these signs, symptoms, they often exhibit with the unusual behavioral changes. So when they don't feel well, so we may start to hide more frequently or just they act differently. So they will try to disappear. They will not try to come and play with you. So if you notice any of these unusual behaviors in your cat, with or without in the above signs, talk to your vet. So this is what is the major classical advice you should need to keep in consideration. Physical warning signals of cancer, they are often harder to spot in the felines, so staying alert to behavioral changes. So these are the behavioral changes you need to take care. Once these behavioral changes appear, so means they should have to get rid of this problem. Treatments, treatment options, they vary and depend upon the type of the stage of the cancer. Okay, common treatments, they include the surgery, chemotherapy using the chemicals, or the treatment or radiation immunotherapy, just like in case of human beings, we use these type of treatments, or the combination of these two therapies. So success depends upon the form and extent of the cancer and the aggressiveness of the therapy. So it means that early detection is the best cure. Some owners, they opt for no treatment of the cancer. In that which is palliative care, means symptomatic treatment, you take care including the pain relief, it should be considered. In case of the vomiting, diarrhea, you are going to give some anti-vomiting or anti-diarrheals. Or in case of the pain, in case of temperature, you are going to use antipyretic or antipyrexia. Some cancers, they can be cured. Almost all patients, they can receive at least some benefit from the treatment. So if your cat cancer is not curable, so there are still many things you would feel, your pet will feel better, mean probably you are going to use the palliative treatment. And remember, the good nutrition is very important for your loving care and generally enhance your care's quality of the life. Then second disease, which is very much common, for which the vaccination, we remember we give you the period for the vaccination, when for the vaccination should be taken care for the feline immunodeficiency virus. It's a viral problem. Cats infected mostly with this disease, they do not show the symptoms until years after the initial infection occurred. So it means it is what you can say, it is a hybrid type of the problem. It is not apparent and it will be obscured unless until infection suddenly appears. Although the virus is a slow acting, so it means a cat immune system is severely weakened once the disease takes hold. So it's just like we take an example of COVID nowadays. So what happens, your immune system is going to be disturbed and ultimately it is going to disturb all parts of the body. Infected cats, they're receiving the supportive medical care and kept in the stress-free environment is very important, because if we cannot take care of this type of the virus problem, so we should have to take care of the animal in terms of the stress-free environment, indoor environment, and then they can live relatively comfortable lives for months to years before the disease reaches to its chronic stage. Because once the disease appears in the chronic stages, it is difficult to control that one. So we shouldn't need to be very much aggressive in making the treatment or providing the alternative ways to keep our animals safe and healthy. What are the major signs symptoms? Basically, we should know it is an immunosuppressing virus found in cats worldwide. It is mainly spread from the cat to cat bite wound. So it means the disease is quite very much infectious. It can spread from one animal to the other animal. Then the cats with the FIV, they need to be kept indoor at all the times because they should not be allowed to be bite to the other animals. That disease should not be spread. It is a manageable condition. Cats with FIV, they can still live happy lives. It can be controlled. So what are the major signs symptoms? Enlarged lymph nodes, fever, temperature there, anemia, weight loss, poor appetite. Some of these symptoms you see, they are quite very much common in most of the diseases. But in that case, we are preferred to make the differential diagnosis. Abdominal appearance or inflammation of the eye, that is called as conjunctivitis, inflammation of conjunctiva. Inflammation of gums, gingivitis, gums, they will be inflamed. Stomatitis, mouth would be inflamed. Dental disease, skin redness, wounds which cannot be healed, sneezing, discharge from eyes or nose, which are very much common. Frequent urination, polyuria takes place. Straining to urinate or urinating outside the little box. So it is a very classical sign. It's a very classical sign of diagnosing the FIV, feline immunodeficiency virus, and as well as the behavioral changes. How we will diagnose? We will diagnose by the blood testing. Means virus appears, so we'll come to know within the blood, the virus will be present over there. Status of every cat should be known. Which stage of the virus is prevalent over there. The most common type of test looks for the presence of the antibodies to the virus in the blood. So means once the virus as an antigen enters, it is going to start producing the antibodies. So we'll come to know that what kind of the antibodies they are present over there. So no test 100% accurate for all the time, and your veterinarian, a vet, will interpret the results based and results, and then will determine that which is the stage of this virus is present and what kind of the treatment should be given. Unfortunately, there is no specific antiviral treatment for the FIV. Just like we know, we just only have to switch to the vaccination schedule. The cats, they can carry the virus for a long time before symptoms appear. Means it is a hidden disease. Symptoms will only appear once the infection starts. So therefore, the treatment focus on the extending the asymptomatic period. So if the symptoms have set in, on easing the secondary effects of the virus. So you will just only manage those symptoms which appear on the body of the animal. So veterinarian will prescribe maybe some of the following treatments for the secondary infections, because once the immune system will be disturbed, so it means that their body is prone to the other antigens, other viruses, other bacteria, and the other infections to the body. So you will definitely go for the treatment for the medication of those secondary infections, which will come as a result of the FIV. Healthy palpable diet, so definitely provide the good nutrition. Fluid electrolyte balance should be there. There should not be any loss of the water or the fluid from the body. Anti-inflammatory drugs should be given, immune-enhancing drugs, which are going to increase the immune system of the body so that the body should not catch the other infections. Parasite control is one of the very important things. Second disease, the next disease, very classical disease, quite very much common in the human beings as well, the diabetes. So probably we know almost every third person or the fifth person, depending upon the classically statistical data, that every third person around the globe or every fifth person around the globe, he is a diabetic person. So it is also a very common disease in case of the feline or the cats. It is a condition which occurs when the body does not produce enough insulin or cannot properly use the insulin to break down the sugar in the foods. We know food that is a rich source of the carbohydrates, and it's going to produce sugar contents would be there, glycemia will take place. How will you take care of that one? It is a complex disease by either a lack of the hormone insulin or inadequate response to insulin. So after the cat eats, her digestive system breaks food into various components, including the glucose is carried into her cells by the insulin. So when the cat does not produce insulin or cannot utilize normally, her blood sugar level will elevate. The term which is normally used is the hyperglycemia. So what the result is the hyperglycemia, which if left untreated, it can cause many complicated health problems. So means the diabetes itself is a hub of the other diseases. Probably the vascular changes takes place as a result of the diabetes. What are the common classical signs? So probably if God forbidden, if you're not the diabetic person, so definitely you will see those signs appears in your body as well. Drinking excessively, taking much more water, overweight or history of the being overweighted previously, sudden weight lost without dieting. Suddenly your body weight is going to decrease. Initially huge appetite, eventually inappetence and vomiting. More frequent visit to the litter tray, and lethargy, weakness in the hind legs, cannot walk properly, cannot run, cannot come to you, and the unkempt coat. If you think your cat may have the diabetes, please contact your local veterinarian to make an appointment. That these are the signs appears over there, and then he will diagnose either your cat is suffering from the diabetes, which type of diabetes. So classically, we know there are two basic types of the diabetes, type 1 and the type 2. Absolute stoppage of the production of the insulin, type 1. Type 2 occurs when the cells, they are not using insulin. Insulin is there, but the cells, they cannot take up the insulin. It's normally called as the non-insulin dependent diabetes mellitus. It occurs most frequently in the obese cats. So your cat will eventually need the insulin injections in that case. Type 2, impaired insulin production along with inadequate response to the hormones. Hormone as an insulin would be there, but it cannot be taken up by the cells. Causes, what are the major causes? Exact cause is known. Most important reason, that is the genetics. Pancreatic disease, because that insulin is going to produce from the pancreatic beta cells. Certain medications and abnormal protein deposits in the pancreas, they play a role in causing this disorder. The most important factor in the development of diabetes is to be obesity. Gender, male cats, they are more affected than the females and the age. So it means this problem is much more pronounced in your male cats as compared to your female cats. How you are going to treat that one? So each diabetic cat is individual and will respond differentially to therapy. So each animal has its own physiology, has its own response to your body. Diabetes treatment is based on how severe the signs and the disease are there and whether there are any other health issues that could complicate the therapy or not. Some cats, they are ill when first diagnosed and require intensive hospitalized care for several days to regulate the blood sugar levels. So you need to measure blood glucose levels of the cat. Cats who are much more stable when first diagnosed may respond to oral medication and high fiber diet. So they have to respond to the oral medication and the high fiber diet. Insulin injections are necessary for adequate regulation of blood glucose because hyperglycemia would be there. So to get rid of this problem, need to give the insulin injections intraperitoneally. So once you pet individual insulin treatment established, you will be shown how to give him the insulin injection at home. Your pet will advise you how to give, how much the dose, which route preferably is the intraperitoneal should be given in case of the cats. Your vet will also show that how to perform the glucose test at home. It can also be performed at home, just like we take the blood sample and then we measure the level of the glucose. So it will explain to you, it's important to always give your cat insulin at the same time every day and feed at regular meals so that the medication to coincide with the peak insulin level. Because when you give the diet, the insulin level will be more because to cause the metabolism of the increased blood levels glucose in the body. The next, heartworms is very important, very classical disease. It is a disease in case of cats spread by the infected mosquitoes. This is increasingly being recognized as an underlying cause of the health problem in domestic cats. Probably we can use the word the pets. Cats are an atypical host for the heartworms. They are not typical. They are not typical, but they are the atypical host. Its name shows heartworm primarily causing the lung disease. It is not present in the heart. It is going to cause the problem in the lungs. It is an important concern for cat owner living in areas densely populated by mosquitoes, and prevention should be discussed with the veterinarian because this disease is going to be propagated, spread with the help of the mosquitoes. How we should know that what are the major signs of the heartworms? Heartworms risk, they are equal to the dogs. This is why it is important for all cats to receive the heartworm prevention. So you should discuss prevention with your veterinarians. What are the signs? Coughing and difficult breathing. Since we know it is going to cause a problem with the lungs, these symptoms are associated with the feline asthma. Asthma would be there in case of cats. Difficulty in breathing, allergic bronchitis, inflammation of bronchioles will take place. Lethargy to the body, rapid heart rate would also be increased. Decreased appetite or loss of appetite, weight loss, also classical sign, vomiting, diarrhea, blindness is very important sign in case of the heartworms. Cannot see, collapse, convulsions, or probably at the end certain death. So out of these, the few signs, just like the weight loss, vomiting, diarrhea, decreased appetite, rapid heart rate, these are very common classical signs for the other disease as well. So probably what you know how the mosquitoes they are going to infect them. They develop in the mosquito to infective larvae in the 14 days. The mosquitoes they bite the cat and transmit the infected larva. So larva, which is the what you can say is the smaller stage of the full infection. Larva develops in the tissues for 3 to 4 days before migrating to the heart and the blood vessels. Once they will migrate to the heart and blood vessels, disease will appear over there. Larva mature into adult, heartworm in the heart and blood vessels, microfilariae develop in some cats. So after the stage of the larva, so microfilariae they will develop, and the mosquito again they are going to dog with the circulating microfilariae. They will present in case of the dogs. These microfilariae will be present in all of the blood vessels. So mosquito ingest microfilariae with the blood meal. So again, when the mosquito will bite to the body of the animal, it will take the microfilariae, and again the story will start. Microfilariae will develop in the mosquito. So this is the cycle, this life cycle. It is almost going to take the 7 to 8 months. So probably it will go for the 7 to 8 months. It will go like this one, that how this stage is going to continuously take place in case of your cats, in case of your dogs, in case of pets. So we'll see that this is the life cycle for the heartworm. Diagnose is not easily as diagnosed as in the dogs. Routine testing requires a combination of blood test. Again, so blood test, we'll take the blood test and we'll see for any appearance of the microfilariae present over there, larval stages, can you develop, can see under the microscope. If they are present, then you can see, yes, heartworms are present over there. When cats show signs of respiratory difficulty, heartworm is suspected. Diagnosis based on cat's history of going anywhere outside, any area where more mosquitoes are present, or maybe any of the area, the tropical region where chances of spreading the mosquitoes are present, radiographs, echocardiograms, and the blood test. These are the classical signs. They are tests. They will give you the diagnosis for your disease. Treatment. Actually, there is no FDA approval drug to treat the heartworm disease. Surgical removal of the adult heartworms, it can be a treatment option, but it's not easy. It's not feasible to surgically remove the heartworms because it's very, very difficult to cause a surgery in those animals, preferably to look for the microfilariae. Some cats, they are able to fight the infection of their own, means their immune system would be quite very much strong enough that it will be stopped. So, but however, the following can occur if heartworms are not monitored and treated. So what will happen? In that case, the walls of the heart, they will be damage to pulmonary blood vessels, which means both the major important cardiovascular system and the respiratory system, they will be damaged. They will be at stake. Possible obstruction of the blood flow through the pulmonary arteries. Again, the respiratory system is at stake. Impaired breathing, heart and lung failure. Again, they are going to cause the other two major important organs, kidney and the liver, and ultimately is the sudden death. Worms, they are very much important. Is very, very common disease nowadays in case of the cats. Common feline intestinal worms. Cats, they can acquire a variety of these parasites, including some they are commonly referred as worms. So you can see we can classify these worms into the roundworms, whipworms, hookworms, tapeworms, and the lungworms. So that depends upon their size, depends upon their shape, depend upon their digestive tract. So sometimes the cat demonstrates few to no outward signs of infection, and the infestation can go undetected despite being a serious health problem. So some feline parasitic worms, they are hazardous for the human health as well. So it means if they come in contact with you, so they can also going to cause your damage to your body. So remember in the previous webinar, I mentioned you that if your animal is sick, so you have to take care of your animal. Otherwise, you or your loved ones will be also at stake. What are the major common types? Just like I have shown you over there, roundworms, hookworms, tapeworms, and lungworms. Roundworms, most important common internal parasites. They resemble just like the spectacles with your kids just like love to have it, eat it. Adult worms, they are 3 to 4 inches long. So you can see the roundworms present over there in the very first one. Then having the hookworms. Hookworms much smaller than the roundworms, less than 1 inch long, and they reside primarily in the small intestine. The most important place for the hookworms, they make a hook. They will attach on the wall of the intestine in the form of a hook, and then they will continuously start sucking the blood from there. They feed on the animal's blood. they will continue to start sucking the blood. So ultimately, your body weight of the animal would be decreased. So they can cause a life-threatening anemia, which is the loss of the blood from the, in case of kittens particularly. Tapeworms, they are long, flattened, segmented parasites. They have the segments. They range from the 4 to 28 inches in length. You can see how much long they are. It can cause infection, can cause the vomiting or weight loss, and they acquire the tapeworm by ingesting the unintimidated host like infected flea or the rodents. So these are tapeworms, and then lungworms also. They reside in the lungs of a cat, as name indicate, present particularly in the lungs. So most cats, they will not show any signs of having the lungworms, but some they can develop a cough. So snails and the slugs, they are the popular intermediate host of this type of parasites. So what will happen, these lungworms, they are going to attack particularly the body of the snails and slugs. And once your animals, once your pet, your cat or dog is going to eat that snail or slug, so it is going to transfer to the body of your animal. So means snails and slugs, they will act as intermediate host where the complete life cycle of the lungworm will be taken place. So what are the major again signs, symptoms of the roundworms? They appears to have a pot belly. Roundworms appear in the vomit or the feces. You can see in the cat. Dull fur, weight loss or failure to gain weight, diarrhea and the coughing. So these are the major classical signs. So ultimately in that case, the most important classical sign to examine or to make a diagnosis or differential diagnosis, that is to take the stool sample. Not the blood sample, but the stool sample as well. So in the stool sample, the most of these worms, they will be present over there. So for the treatments, the most important thing, do not attempt to treat your pet yourself. Your cat should be treated for the specific type of worms it has, because you are not sure what kind of the worms they are present over there. Because normally we use the dewormers, which remove the worms from the body. Dewormers, they eradicate the type of worms. So it is only the responsibility of your doctor, of your veterinarian, will determine what kind of the worms based on their diagnosis and the infestation your cat has. And your veterinarian will also be able to tell you if the dewormer should be repeated and when it should be repeated. Not all the dog medications, they are safe for the cats. So some are to make the differential. Some over-the-counter deworming medications, they can be harmful. So probably when you go to pharmacy, ask that your animal is having a problem, is having the worm problem, it will give you the over-the-counter, it will give you the dewormers, but please don't use that one because you are not sure which kind of the worms present over there. So definitely these kind of the medication, again, they will spoil the health of your body, and the chance of getting the infection will be more because the immune system of the body will be disturbed in case of using those medicines which are not required to the body. Transmissions is very important. So remember in the previous lecture I told you zoonotic diseases. So this is very important from the zoonotic point of view. These worms, they are going to transfer from the cats, from the pets to you. Large number of roundworms eggs, they can accumulate where cats defecate. So people, especially children, when they ingest such eggs, they can develop serious health problem. Blindness, encephalitis, inflammation of the brain, meninges, and other organ damages, depending upon the age and the area where it's going to happen. Treatment of blindness caused by the roundworms may involve surgical removal. So surgically need to remove in case if the blindness takes place by the roundworms. Hookworm larvae, they can penetrate the human skin and cause the lesions. Symptoms appear on the body. People can acquire the tapeworms through the ingestion of the infected flea, although this is very rare in case of the hookworms. So remember, do not take the dewormers as per own choice. Ask the veterinarian, ask a doctor, and make sure this is the disease which is very important from the zoonotic point of view. It can be transferred to your body or to your loved one as well. Next are the very common dog diseases. So after the cat, some are very common dog disease since you have the possibility of keeping the dogs as the pets. Canine distemper, canine parvovirus, name indicates parvo, heartworm again, rabies, Lyme disease, kennel cough, leptospirosis, and the kidney diseases. So they're very much common dog diseases. So again, you can see in that case, you can see what happens in case of the dogs, what kind of the symptoms they will appear over there and how they look like in that case. Symptoms of the unwell dogs, just like in case of the symptoms of the unwell cats. Runny eyes, fever, coughing, vomiting, paralysis, cannot move, lethargy, very slow to move, diarrhea, then dehydration. In some case, dysentery is also there, means blood also appears with the feces. and the weight loss. So these are the very much common important symptoms of the unwell dogs. Treatments, very common treatments. Although the doctor will try best to treat the dogs with the distemper by providing supportive care and preventing a secondary infection. Again, secondary infection is very much important to take care, because when the immune system is disturbed, your body becomes hub. It can be prone by the other diseases. So in that case, we have to take care. So we'll give the plenty of the rest and the fluids. Okay. Vets treat the dogs with parvo by providing a plenty of the fluids, electrolytes, and secondary infection prevention. But it can be often better. If your dog has a heartworms, expect rigorous regime of steroids, antibiotics, and organ arsenic injection. There's no treatment for the dogs once they contract the rabies and it's fatal. If your dog has a kennel cuffing, your veterinarian will prescribe the antibiotics, any of the antibiotics which is going to affect the respiratory system. Cough suppressants, plenty of rest. But when she's home, keep a watchful eye on them. If they become the listless or lethargic, take them back again to the veterinarian to make sure they don't have the pneumonia, because it's very much common classical sign. After the common cough, pneumonia will take place, because both the diseases, they are going to affect the respiratory system of the body. If the dog has a kidney disease, Lyme disease, your veterinarian will prescribe medications and kidney-friendly diets, but the best way to prevent is catching it early. So regular veterinary checkups and appointments. Vets can measure the levels of creatinine, which is the end product of the protein metabolism in the body. It should be measured, it should be taken up, because it will let us know what is the current common stage of the kidney. Either the kidney is going to filter appropriate level and a normal level of the creatinine from the body, or it is below or more from the normal levels. Prevention, just like again we say, is better than the cure. Vaccination them, vaccine them. Again, we should have to take care of those diseases against whom one should be vaccinated. Just like, again, I'm going to repeat the example of nowadays having the COVID virus and the corona infection over there. So if we are sure enough that we are taking the 2 doses of the vaccination, we are quite safe enough. So in case of the pets, it also goes like this one. So we will have to vaccinate the animal at the proper time. At the proper time, keep them away from all feces, especially infected feces. Take preventive measures with annual blood tests and regular pills, topicals or shots, keeping them from the rabid wildlife. Rabid wildlife where the animals are going to bite one another. Checking his body for the ticks after outdoor exposure. Because when they go outside, ticks, they are having, they will come on and they will stick on the fur, or the hair will attach on the hairs of your body, of the animal, keeping them away from the sick dogs. So most important common disease in case of the cat, dental disease. Oral infections, acutely the most common disease and tend to become an issue in case of the age of the 3. Tartar gingivitis, inflammation of gums, most common oral issue, while most severe is the periodontal disease, such as abscesses. Abscess will develop with the pus, more often occur in the dogs in the later stage of life. So you can see in this the stages of the life, stage 1, 2, and 3, and 4, periodontal disease. These show the progression of the periodontal disease affecting the upper 4th premolar. We're having the premolar, molar, canines, teeth. Daily cleaning, dental diets, and regular professional cleaning can prevent the disease. Remember, when we discussed in the previous webinar, in the previous lecture, that taking care of the animals also help them to wash their face, or maybe making a habit of cleaning their teeth. What are the major symptoms? Bad breath from the mouth, loose teeth, change in appetite, particularly refusal to eat the dry food, discharge of blood or the pus from the mouth, drooling, bad temper, lumps on the gums or under the tongue, and discolored teeth and gums. So if your animal is quite very much lovely with you, you can easily and closely monitor these signs, these symptoms appear within the mouth of your pet. If they appear, it means the animal is having the periodontal disease. Treatments for dental disease: cleaning, extractions, remove the teeth, sometimes even a root canal, and these treatments will need to be administered by your veterinarian. Quite very much sure. Oral care for your pet is important, and regular visits should be taken care. If your pet is groomed regularly, ask your groomer to clean his teeth as well. So means if you are having a habit of taking your animal to the groomer, so ask the groomer, apart from taking care of the skin and the hairs, also clean the teeth, so that no chance of getting the infection in the teeth. Canine distemper, very important viral problem. Is called as sometimes called as hard pad disease because it hardens the dog's nose and the foot pads. Extremely contagious viral disease. Contagious is going to infect the other animals as well and also be transferred to the human beings as well through the airborne exposure or contact like shared food bowls. If you think your dog has a distemper, take the veterinarian and ask the veterinarian to best treat the dogs with distemper by providing the sportive care. Because again, we see in case of the viral problems, once the viral will complete its cycle, only then it will get rid of from the body. So in that case, whatsoever the other diseases, the other symptoms they appear, we should take care of those symptoms. So they are called as a sportive treatment or symptomatic treatment by giving them the fluids or whatsoever and giving the proper nutrition. What are the major signs and symptoms? Fever, eye discharge, inflammation, nasal discharge, coughing, vomiting, diarrhea, quite very much common, appetite loss, lethargy, heavy mucus or yellow discharge from the nose. This is very important. This is one of the classical signs, or you can say is the differential diagnosis, and foul smelling diarrhea. So these are the common signs of diagnosing the canine distemper. Ear infections, very much, sometimes very much important. You don't know, but the animal is suffering from that one. That's why continuously flapping his ears. Suffer from the recurring ear infections. It's very likely the allergies are the culprit, and the most likely allergens are the corn, wheat, and soy in their food. So what happens? The animals having these food diets, and they will become allergic. This one, but he cannot let you only when the appears signs. Dogs with the large pendulous ears tend to be more susceptible to these infections. If you notice that scratching, you are pawing at its ears, shaking his head continuously, rubbing his ear against the floor or the furniture, it is a classical sign or indication that is having an ear infection. So just closely monitor, open the ear, look with the help of the light or the touch, any kind of the infection present over there. So symptoms, they include the redness of the ear canal, scabs or crust around the ear, hair loss around the ear, balance issues, walking in circles, pain and the hair losses. So these are the common symptoms. They appear in case of the ear infections. What are the major treatments? The first step is to clean and dry the ear. Definitely, it should be taken there. If it's a lot of pain, he may need to be sedated at this stage. Examination by your vet will determine what type of infection your dog may have. And then we're going to use either the topical antibiotics or the antifungals to get rid of these kind of the bacteria or the fungus, which are going to making a hub of the disease and spreading the infection in the ear. The next is the itchy skin or skin infections. It is also very much common. Scratch, all dogs scratch on a daily basis, but if you notice the dog scratching instantaneously, it is a sign that something else is going on. So number one cause of itchy skin in the dog is a food allergy. It is very much important. So food allergy, so means having this problem in the skin as well. Again, the corn, wheat, and soy in the many food dogs. Switching to low allergen foods such as lamb and rice may be the key to relieve your dog's itchy skin. Once you see that these symptoms appear, just try to change the food habit or the food material of your animal. Symptoms, diet changes do not make a difference, then visit your veterinarian. In that case, bacterial yeast infections can also be the cause of the canine itching and can lead to the problems known as hot spot. So hot spots cause very painful sores, especially for the dogs with the thick fur. So in that case, probably we can also use some of the shampoos over there in that case to remove this one. Depending on the type of infection, your veterinarian will recommend as simple as a shampoo to treat the allergies or antibiotics ointments. Topically, locally, either you have to give a bath to your dog or you have to apply an ointment or antibiotic on the fur or the hairs of the animal of your dog. It can be a number of reasons for your dog's itchy skin, so getting a proper diagnosis is the first step in treating the issue. The next is the stiffness and the pain with the symptoms. If your dog is 6 years of age or older, you may notice that getting up from a sitting or lying down position seems more difficult, or perhaps climbing stairs seem difficult as well. It means he is not active, lethargic. So these are the symptoms that is experiencing the stiffness and the pain in the forelimbs or maybe in the hind limbs, the front two legs or maybe the backward two legs. Treatment of the pain and stiffness in the dog, first keep your dog at a healthy weight. Increasing age is very much important, weight which has been lost. In addition to helping your dog maintain the healthy weight, consider using a glucosamine or contrast supplements. So these are both are very much important to maintain, give a strength to the cartilage and the bones of your animals. So a veterinarian can recommend which kind of the supplements they are present in the market and what the dose should be given as per the body weight of your and condition of your animal. Urinary tract problems, UTIs. UTIs, they become evident through symptoms such as frequent urination, breaking house training, blood in the urine, bloody urine, which is known as the uremia, dribbling urine, crying out while urinating, and they will cry out, straining to urinate frequently and obsessively licking the genital area. These are very classical signs of having the UTI problems. So we need to get rid of, see and observe either these symptoms appear in your animal, either any of these symptoms, these postures your animal adopt while urinating. So it will give you an idea that it is suffering from the UTI, urinary tract infection. If you notice these symptoms, again, consult your veterinarian. Your vet will conduct a urine sample. In that case, determine the type of infection, which bacteria or viruses they are going to cause the problem, which kind of the bacteria, particularly there's very specific staphylococcus or streptococcus, they are responsible for causing the urinary problems in both human and the animals as well. And then they will prescribe the proper antibiotic treatment depending upon the nature of the disease and the condition of the animal. Dog obesity. Remember, if I'm not mistaken, in the previous lecture, dog obesity was one of the classical signs, and someone asked about that this is the one of the sign what should have to do, because if the animal is if your pet is very much a food lover, is going to continue to take the food continuously. In that case, body weight would be more will take place. It becomes a problem later for you as well. So best way if your dog needs to lose weight is to run your hands over their rib cage so that it will run fast more, so that it is going to lose the increased triglycerides or the fat components. If you cannot feel their ribs, that is sure indication that your dog is overweight. Means dog is overweight because ribs you cannot compress, you cannot hold the ribs with your hand. In most dogs, obesity is quite obvious, but for the dogs, they are the bit furrier, the rib cage test is the best way to determine if they need to lose the weight. So again, in that case, we have to make sure that the animal is overweight, and we have to decrease the weight of the animal, of your pet. How to cut the treatment in case of the overweight animals? In case the best treatment for obesity is to provide a high quality diet for your dog and make sure he is getting regular exercise. Regular exercise, continuous exercise, taking him with you outside, maybe in the morning walk, maybe in the evening walk with you, and just lure him to run more, so that is going to reduce the increased body weight. It's important to pay close attention to your dog's behavior and watch for changes that may indicate this discomfort. So while these disease symptoms, they are much more common and much more not serious, they do have the potential to become serious if they are not treated properly. In the beginning, if you will overlook this problem, so probably obesity itself will become a hub of the other diseases, because in that case, the metabolism of the body is disturbed. So ultimately, it will cause a syndrome. It's called the metabolic syndrome. If you have any doubt about your dog's health, call and talk to your veterinarian about your concern. These are the problems. I'm not sure what these are symptoms appear. He will check on the history, and then the behavior will observe. Do some sort of he will definitely perform some sort of the examinations, blood smear or the stool smears to a stool check, and then he will let you know what is the major actual problem, and then the treatment should be undertaken. Again, over here it is one repetition from the previous one. These are the very much common diseases which take place in case of the animals. Okay, so we need to get rid of these problems. In case of the dogs and cats, the classical time period available over there. Starting from the 6 to 8 weeks, some diseases, general dewormer vaccines, booster Borrelia vaccines, rabies vaccine from 12 to 15 weeks. Annually, again, we have to give the vaccine against the rabies, against the Borrelia. 9 to 11 weeks in case of the cats, feline vaccine, which we discussed just like in the beginning. Again, the rabies. Rabies is very much common in case both, just like we discussed, very much common in the previous presentation. It's common in both in both cat and dogs, and it is a zoonotic disease, zoonotic importance, travel from the pets to the human beings as well. So we should take care of this vaccine as well. Otherwise, if the animal is going to bite you or your loved ones, so you have to take care of in terms of the treatment as well. Journal dewormers from the 12 to 15 weeks in case of cat, feline. Again, the annual means you have to give the secondary doses for these vaccines for the rabies and the booster and for the general dewormer as well. So very much important thing. Again, we have to remember prevention is better than the cure. In that case, you have to take care of the animals, give them the proper vaccination, take care of your food, take care of their continuously living with you, make them clean and tidy so that they should be protected from the diseases, so that you should not be any chance of having an infection to your pets, and then you will be able to maintain them properly. You will be loved to play with them. With all this one, thank you very much. I have tried my best to give you a very short description for the very much common diseases with some of the very much common classical signs. So my concern is this one: if you come across with any kind of these symptoms and you are not sure that what are the major diseases which have been incurred to your animal, so don't treat them personally and do not give them any medication personally. Try to consult the doctor or a veterinarian. In that case, he will make you a proper differential diagnosis and give you the proper treatment. With all this one, thank you very much. Once again, I'm very much grateful to you, all my audience and the listeners, to provide me an opportunity after showing their interest in this important and enthusiastic webinar known as the Know Your Pets. I know you love your pets, and that's what best I can do for you in helping you maintaining your pets at your home. Thank you very much.
Amazing, Dr. Shahryar. I mean, you have done it earlier and you have done it again. I mean, it was so informative that even, I mean, I have learned so much. I did not knew that actually cancer is so much prevalent in domestic pets as well. But after listening to your presentation, definitely you have added something to my knowledge bank. Now, moving towards the question and answer session, Audrey Young has came back with another question, doctor. Hi, Dr. Shahryar. The obese cat in my housing area are reportedly missing regularly. I wonder if these cats are targeted by the sick cat kidnappers. So is there a gang going on among the animals as well? And on the serious note, do these animals, domestic animals, fight with each other based upon their size, sir?
Yes, exactly. It happens. I think probably it's very good question. Probably when we look at the question, we think that it's a part of the is not a important note, but it's very correct. Because when the animal is having a habit, its body weight is going to increase, and you are not giving to proper food to the animal, wherever he is going to take the food, he is going to reach that and approach that position. In that case, probably the other people or other the kidnappers, they are going to take care of the animals, and you may will lose your pet. But make sure, I want to tell you one important thing. It's very much common. These animals, they are having a very important psychological relation with the owner. Once they know the area from where they belong, so if they will be free, if they have not been kept in the cages, they definitely can approach and then can get back to your home or the owner as well.
All right. Then there's a very appreciating remark by Suhail Ahmed. He really enjoyed your presentation. I have one question, sir, and
Yes,
that
sir.
is all the information that you are delivering over here. Is any part of that information has been taught in your any of your degrees, sir?
Yes, I'm having elective module over here, which is known as the
Okay.
veterinary pharmacy. That is the part of the B Farm, and in one more in our Farm Tech degree program, we are having the veterinary pharmacy module over there, which is of the 2 credit hours. So since it is my specialty, so I used to share some of this very basic information, starting from the anatomy and the physiological point of view for all these animals. Over here, my focus was only on the pets. But over there is focus also on the livestock animals, which also covers the cattle, buffalo, sheep, and goat, or those animals which are helpful from the edible point of view, which gives us the food supplements as well.
So if I get a chance, I will definitely enroll one your module, because
Thank
the
you.
information which you have shared was beautiful, and definitely the pet lovers can use this information on the everyday basis. With this note, thank you so much once again, Dr. Shahriar Afzal, for sharing your information, sir,
Yeah.
and being part of this webinar for the second time. Guys, thank you so much for your time and for your patience for joining us. And next month, we will come with another webinar. Don't forget to visit our website www.mahasa.edu.my. If you need any information, the comprehensive information about our courses is already up there. Thank you so much, and enjoy yourself and stay safe. Thank you.
Thank you, sir.